Welcome back to the basement. Tonight we're talking about the leg, and we're singing 9 to 5 because that's an easy way to remember the number of muscles used in flexing and extensing the thigh at the hip joint. So there are 9 muscles that are used to flex the upper thigh at the hip joint.
I feel all 9 of them right now.
There they all go. And there are 5 that are used to extend it out back behind if you want to kick the wall. You feel all 5?
I feel all 5.
Nice.
Forehand.
So the 9 of them that are gonna flex the leg start out with the major ones, the iliacus and the psoas, making the iliopsoas. Beyond that we have sartorius, which is the most important muscle in the body and the longest, running from the as-is on down. And finally the rectus femoris, biggie right on top. And those are the major muscles. There are some minor muscles, 5 more of them, that are also involved in flexing the hip. First is the tensor fasciolata on the outside, running those tights. Next is pectineus, kind of a groin muscle heading deep down inside. You got gracilis running on the inside, all the way up, yeah. And you got your adductors, all 3 of them. Longus. I think longus. Yeah, okay. Heading down along the backside, and brevis underneath it, and adductor magnus, which is the biggie, kind of on the medial side of things. Yeah, okay. And these are all innervated by the femoral nerve, naturally. Yeah, L2, 3, and 4.
Femoral triangle.
Yeah, coming through the femoral triangle, sure.
Nervus exterior is the most lateral. Right?
Yeah.
Most lateral, and right doesn't go through the fascia.
No fascia there.
That's right. Whereas the artery and vein under the fascia.
Right through the fascia.
That's right.
All right. As for extensors, there are 5 of these muscles. And they start out, they're all innervated by the sciatic nerve, coming from L5 and S1. The first is the biceps femoris, the long head, sort of like picturing Kyle's leg as the bicep of his arm. Semitendinosus and semimembranosus. Which one is most superficial?
Semitendinosus.
I believe tendinosus is on top, membranosus down beneath.
Yeah.
Adductor magnus, again, the posterior version of it, and finally the gluteus maximus. We like big butts, and we can. Ooh, that looks really. Yeah, that's moving nicely. And that one is innervated by the inferior gluteal nerve. Just a little side note. So most of this is from the sciatic nerve, but that one's from the inferior gluteal. Awesome. All right. As for the Thigh Master. Yeah, we're working the Thigh Master now. Gosh, if we only had one here, that would be great to demonstrate. We'll have to pick one up off of eBay. Okay. God, I really used to like that pillow. So inevitably, we're talking about the adductors and the abductors. The adductors are often referred to as the horse riding muscles. So you figure you're sitting on a horse and you got to hold on to it. Or the Thigh Master muscle. I mean, that's really... We should start changing the literature. So as opposed to 9 to 5 with the flexion and extension, with the adductor and the abductor you got 6 to 3. Just split it right in half. So there's 6 adductors working that Thigh Master. Most principally you have pectineus, that other groin muscle right in the middle. You got gracilis, which makes sense, running down the inside. And you got your adductors. Naturally, your adductors are going to adduct. You got longus, brevis, and magnus. Finally, as a minor muscle, you have obturator externus, which comes out the front of that pubic ramus and wraps right around. These are all innervated by the obturator nerve coming off L2, 3, 4. 2, 3, and 4. As for abduction, not the Thigh Master, but more when we're kicking that person next to us in line or whatever, there are only 3 muscles here, and these muscles are gluteus medius, minimus, and tensor fasciolata. These guys are innervated by the superior gluteal nerve coming off the L5 and S1. Supa dupe. What's even more supa dupe is that these three muscles are the same muscles involved in medial rotation. So show us abduction, Kyle. This is what abduction looks like. And you can imagine the same muscles that do that also medially rotate. Yeah, it's kind of the same motion, really. So again, you got gluteus medius minimus, tensor fascia lata, innervated by the superior gluteal nerve off of L5. And S1 maybe. Finally, the last thing we talk about tonight is lateral rotation. There are 7 big bad muscles doing that. And if you laterally rotate your leg, Kyle, you can kind of feel...
I feel it. I feel it.
Feel it burn right in there.
Right there.
And there aren't, it's not a big space, so you got 7 little muscles in there. They're all pretty small. You start out with the piriformis muscle. Piriformis is kind of cool because it splits your superior and inferior gluteal vessels. And it's innervated by the nerve to the piriformis.
Sure.
See, that's the kind of pain here. Whereas all the other places you got one nerve basically, they're innervating them. Here you got 7 muscles and 5 big bad nerves. So, first one is piriformis, and it's got its own nerve named for it. Coming from S1. Below that you got obturator internus and superior gemellus.
Superior gemellus, obturator internus.
Innervated by the obturator internus nerve.
Of course.
Makes sense. South of that, you got quadratus femoris and inferior gemellus.
Superior gemellus, quadrator femoris.
Innervated by nerve de quadratus femoris.
What else could it be?
Naturally. So you got superior and inferior gemellus. What splits those two? Naturally, obturator internus.
Naturally.
Makes perfect sense. 2 last muscles, you got gluteus maximus. We already know which one innervates that guy. It's inferior gluteal nerve. And the obturator externus, innervated by the obturator nerve. L4, baby. That's it. Easy peasy.